This presentation is on predictive analytics and machine learning technology. So what is machine learning? Machine learning enables computers to learn patterns from data and make predictions without being explicitly programmed for every single task. AI can help providers by giving them predictions on patient trends to influence their decisions in the OR. Machine learning analyzes trends of vast amounts of data to make predictive analytics more accurate. And the major goal is for providers to anticipate complications before they can occur. So if you take a look at this graphic, you can see how raw data is used to teach these machine learning technology algorithms, and then that is used for predictive models. So when we're getting new data, it can use the trends from the raw data to make predictions. Traditional monitoring versus predictive technology. So predictive analytics support proactive interventions instead of reactive responses. So traditional monitoring relies on the provider reacting to changes in vital signs after the problem has occurred. This is clinically significant because even short durations of hypoxia and hypotension can increase post-operative complications and delay recovery. Algorithms that are powered by machine learning are able to recognize when a patient is trending towards that complication, and it will notify the provider to intervene early so we can prevent complications from happening in the first place. So this really enhances CRNA's decision making by giving them the opportunity to decide early and with accurate data. Currently, the NSQIP is used to anticipate high-risk patients, but this is a static risk factor assessment. So it's something that we do in pre-op, but it doesn't change as the patient's conditions change in real time. So it kind of lacks relevance to anesthesia. Machine learning in anesthesia these are trained on large data sets from thousands of surgeries. So the more data that it is taught with, the more accurate our predictions will be. So it incorporates data from all different sources like electronic health records, patient histories, and intraoperative monitoring to accurately predict which patients will be at higher risk of postoperative complications. So it gives us real-time alerts for things like hypoxia and hypotension. So in my paper, I focused mainly on how machine learning and predictive analytics notify providers on potential complications to improve patient safety, but this can actually be translated to different aspects of anesthesia practice. I liked how this visual showed how machine learning models are trained by patient data to be able to assess new patient data and then predict outcomes to help the provider make decisions. So in this case, it had previous patients to train it. And then when the unknown patient's data was inputted into the model, it helped to predict the best dosage for the patient. So are these tools accurate? In a large scale study involving over 1 million participants, it demonstrated that machine learning actually outperformed current preoperative risk tools like the NSQIP that we discussed before. And these algorithms scored highly in sensitivity, specificity, and area under the curve, proving its external validation and showing that they're reliable factors for broad clinical applications. The clinical relevance. So post-operative complications are common and they're really serious. They affect up to 10% of our surgical patients. Things like pneumonia, respiratory failure, and prolonged ventilator support all correlate with negative patient outcomes, and they will significantly increase mortality rates and prolong hospital stays. So this highlights the need for early detection and prevention. Patient safety. I would argue that the most important factor in implementing machine learning and predictive analytics into practice would be to improve patient outcomes. Predictive technology allows anesthesia providers to detect subtle changes before they become complications. Early intervention translates to reduced ICU stays, decreased ventilator times, and overall just improved patient outcomes. Early risk identification can lead to fewer complications. Workflow improvements. So machine learning models can analyze preoperative data to identify our high-risk patients for complications, and that allows for CRNAs to prioritize these cases and allocate their resources appropriately. When you treat a complication before it becomes emergent, it increases the time that the provider can make their decisions, and it allows them to focus on patient care and make proactive decisions rather than reacting to adverse events. Predictive analytics also improves workflow efficiency by automating routine tasks like risk assessments and documentation. Legal and ethical considerations. So, while predictive analytics are a powerful tool, CRNAs still will remain legally responsible for the patient care that they provide. So, these alerts are meant to be suggestions and not orders. Ethical concerns include consent. So, when these patients' data is being used to train these algorithms. So patients are consenting to anesthesia and surgery, but they might not be aware that their data is being used to train new technology. And patients should have the right to decline this. So ethical practice requires transparency with patients, so they would know how their data is being used. Institutions really should be expected to integrate predictive technology data usage into their current consent process so we can support patient autonomy. Another ethical consideration with machine learning and predictive technology are the potential biases that it presents. So machine learning models are trained based on old data. So if there is something like an underrepresented population, it might be creating inaccurate predictions. So this just highlights the importance of CRNAs, understanding how these algorithms are working, and we should still be using our critical thinking skills to treat patients. Data security and privacy. So HIPAA compliance is mandatory when using the predictive technologies, and it just requires strict attention to data security and privacy. So hospitals' policies should ensure that patient data is encrypted and stored securely, and separate consent is needed if we're using their data to train these algorithms. Patient-specific care. So one of the major advantages of predictive analytics is its ability to support patient-specific care. It analyzes large amounts of data to understand specific patient needs, and it also identifies patient risk factors prior to surgery and encourages appropriate interventions. High-risk patients can receive tailored anesthetic plans like proactive respiratory therapies to prevent complications. Despite the many benefits, there are some challenges that come along with implementing any new technology. Providers may experience alarm fatigue or over-reliance on technology. Providers must remain competent to react appropriately in situations where there's maybe a power outage or a system downtime. Structured training simulations are required for successful implementation of these new technologies, so providers can understand how to use the technology appropriately and understand its limitations. It must also be able to integrate with current electronic health records and monitoring systems. Overall, this is a dynamic process, so we must continually evaluate and adapt to the individual needs of each workplace to optimize its use. In conclusion, predictive analytics and machine learning provide CRNAs with valuable tools to improve patient safety. It reduces post-operative complications and enhances the workflow. There are some concerns regarding ethical, legal, and data security, so we just need to address those.